Let's now introduce our guest. Joining me on the show tonight, Dr. Edmond Fernandes, founder and CEO of the CHD Group, Dr. Harjeet Singh Bhatti, former president of the Resident Doctors Association of AIMS, Dr. Dayanand Sagar, president of the Karnataka Association of Resident Doctors. Dr. Edmond Fernandes, you know, there are a lot of issues here that need to be discussed. Of course, the delay in the NEET counselling and admission process has meant these doctors are extremely overworked. 40 to 50,000 doctors who could have joined service by now are still waiting for the process to be completed. But there is also the issue of what happened yesterday in the national capital. I mean, everybody obviously agrees that, you know, the police meted out very shabby treatment to these doctors. The question then also arises, hasn't the centre completely mishandled this issue? Could this not have been handled much better?
Yeah, hi Neha. So basically we need to look at this from three layers. The first part of it is the agitation or the dissent shown by resident doctors and those who would be postgraduates is very legitimate. They were previously supposed to give their examination in January 2021 and that was called off 3 days earlier and later on after the EWS quota system was introduced. So which is very unfair in the process of streamlining systems. Secondly, in the hearing, Honorable Justice Chandrachud's bench in the Supreme Court has very clearly told the government as to go back to your previous policies and look into this matter for next year. So the health minister's assurance or mere politically correct statements of saying the matter is sub judice does not really arise. And let us also understand the fact that Supreme Court is in the vacation bench right now. So obviously once it resumes, things are going to be addressed. My submission to the Honorable Health Minister is that anyways you have a disproportionate ratio of PG, UG seats in the country. 50,000 odd PGs are now going to get admissions into the, into the regular process. India's doctor-patient ratio or India's doctor-patient relationship right now is far below the World Health Organization norms. We are the world's most depressed country. We are #1 in road accidents. Our non-communicable diseases in terms of diabetes, in terms of cardiovascular diseases is skyrocketing and it's almost a world leader.
Yes.
So why are we trying to really frustrate systems instead of enabling things and bringing them into the healthcare sector and delivering patient care services?
You're making a very important point.
The health minister out here is that you want to raise the quota for economically weaker sections. Fair enough, do it. So neutralize and equalize UG-PG seat ratios and then bring it up.
Okay, you make some very important points. Clearly, our doctors are overworked. The treatment that's being meted out to them is simply not fair. And you are saying that you are not buying the assurance given by the health minister. Dr. Fernandes, Dr. Bhatti is making a very critical point. He seems to believe that, you know, the very introduction of this EWS quota was nothing but a political gimmick on part of the government, meant to be a vote catcher, and that has crippled the entire healthcare system. And the result is that these resident doctors are paying the price because they're overstretched, overworked, overburdened in the middle of a pandemic. Is that something you agree with? And also, very quickly, what is the way ahead?
So Neha, eminent pathologist Rudolf Virchow had said long ago that medicine is a social science and politics is nothing but medicine on a greater scale. So as far as Dr. Bhatti's opinion on this being a political gimmick, I would like to take a referendum to the Supreme Court's judgments. So in the government's own words, the matter is sub judice, whereas in the Supreme Court's judgments, the court has always pitched for speedy trials, no adjournment cultures, and it has also stressed upon the cases that around 4.5 CR cases in the country are pending. So this is a perfect pickup moment for the Supreme Court to just have its vacation bench respond and direct the government to simply start the counseling process. With regard to the EWS, it's a beautiful thing to do. And like I've offered this suggestion to the Honorable Health Minister, that you simply equalize the UG-PG ratios in the country. This would also bridge the gap in the doctor-patient ratio in the country, and probably one doctor to 1,000 patients ratio will be realized in our lifetime.
Okay.
India is a
That's certainly a good suggestion. That's certainly a good suggestion, Dr. Fernandes. But is the government listening? Also, Dr. Bhatti says that, this is something that has been just thrust upon the doctors, upon the healthcare system, the government seeking to do this in a hurry without having done its homework. Given what's happening around the country, let's hope the Supreme Court of India will take note and resolve this issue at the earliest, because there is just too much at stake. Patients are suffering, the doctors are suffering, our healthcare system is suffering, and we are still in the middle of a once-in-a-century pandemic. Let's not lose sight of that. And even as we focus on the larger issues here that need to be resolved, let's not forget that the treatment that was meted out to our doctors yesterday by the Delhi police is certainly a disgrace. Remember, these are our COVID heroes, our COVID warriors. Not too long ago, we were showering flowers on them. They certainly deserve better. We can't be raining blows on them in the manner in which it was done by the Delhi police yesterday. Let's hope that this issue can be resolved at the earliest for the sake of the doctors and the healthcare system of this country. Thanks very much, gentlemen, for joining me on the show, and thanks to the viewers for watching.
Subscribe to our YouTube channel and press the bell icon to receive latest updates and stories.